Good afternoon, everyone. I'm Barbara Rose. I'm the Senior Project Administrator at Hospice of Cincinnati, and I'm over all of the advanced illness programs. It's great to have an opportunity to talk to those of you attending the NPHI Summit and talk a little bit about our really terrific program, Conversations of a Lifetime. I've been with Hospice of Cincinnati for 8 years and came on to specifically design and implement this program, Conversations of a Lifetime. So always welcome the opportunity to tell folks a little bit about it. So Conversations of a Lifetime we started in 2013 and we're backed by funding from BI3, which is a local funder affiliated with our health system. And at that time, we received a very generous 5-year operating grant for a little over $2 million. We did this remarkable work with really a very small and talented team. Stephanie Learn is my project specialist. I had advanced care planning liaison and input from our chief marketing officer, Janet Montgomery, to do all of this work that I'm going to tell you a little bit about. So the strategy for Conversations of a Lifetime was really to look at normalizing conversations and advanced care planning, both in the healthcare community as well as the community at large. And we brought together several evidence-based strategies and then used a lot of local creativity talent to do some community engagement work. So I'm really pleased to talk with you a little bit about that. So the first thing that we did was we knew that physicians in general know the importance of advanced care planning conversations, but will readily tell us that they don't really have experience or training in how to have those conversations. So we worked with Vital Talk, which is a national organization led by physicians around provider-patient communication, and devised a custom half-day session led by Vital Talk facilitators with small groups of physicians really helping coach and practice advanced care planning conversation starters. Over the 5-year period, we trained 342 providers. Secondly, we know that physicians, particularly in the ambulatory care setting, but all physicians and providers have a lot going on and are being asked to do a lot. So we brought in the Respecting Choices Advanced Steps Facilitator curriculum. And for those physicians that went through our Vital Talk training, then we had someone from their practice or someone on their team come through the Respecting Choices curriculum, and we had almost 1,000 folks came through our advanced care plan facilitator training. So between the Vital Talk and the Respecting Choices, about 1,400 folks trained and coached in having these conversations. The third thing that we did, particularly in our learning laboratory of primary care practices at TriHealth, was after the training and the coaching and some changes that we made to the EMR, the Epic system, was we created a best practice alert using a handful of criteria that were tested at Gundersen Lutheran that indicated if patients met this criteria, they would be a good candidate for an advanced care planning conversation. And then we also had a nurse as an advanced care plan liaison provide support out at the primary care practices to really help coach. The fourth thing that we did was really a lot of fun community engagement activities, and worked with a local creative agency called the AGAR, and came up with 2 campaigns actually: Things You Shouldn't Wait to Say, and then Things You Shouldn't Wait to Do. I'm going to pause here and let you watch just a 1-minute video that shows some of the fun and creativity we had with this campaign. after those campaigns, in 2018, we went with a different agency and came up with the idea of Have You Had the Talk? Over the 3-year period when we did these activities, we had about over 1 million social media impressions from a variety of sources. We made the local news 3 different times over those 3-year period, just because of the innovation and creativity of these signs. So got some really great exposure from the community engagement and had a lot of fun doing it. So this is a great picture of my team, Kelly and Stephanie, and just remark that we did have a fair amount of local and regional impact. In addition to the local news coverage, we've done a lot of work site programs and provided content expertise at the CPC Plus statewide meeting, and then we're also on the Ohio Honoring Choices Task Force. One of our proudest accomplishments, I have to say, is our national reach. Because we had such great results in the Tri-Health primary care practices, we had some great faculty guidance, and we took the plunge and wrote up our results and were published in the brief report format in the Journal of Palliative Medicine online in November 2018, and then the print version in April of 2019. So really a feather in the cap of Conversations of a Lifetime and Hospice of Cincinnati to get such great coverage on the results. This is a graph that shows indeed we made an impact with initiating advanced care planning conversations. The graph on the left shows the study period, about 7,200 to 8,000 conversations initiated, and we knew that this happened because there was a discrete field in our electronic medical records, so we were actually able to report on that on a monthly basis. And then on the right side of the graph shows continued success at initiating advanced care planning conversations in the primary care offices. So over the 4.5-5-year period that Conversations of a Lifetime was active and we were measuring, we can count almost 22,000 conversations initiated. So a process measure, but a pretty robust process measure at that. So in a nutshell, we've had great success and really great fun in helping the community and healthcare providers really get a better understanding of the value of advanced care planning conversations, get some skill and comfort with how to start those conversations, and also raise awareness in the community through our community engagement. I'd be happy to talk to anybody about our program and successes. My email address is on the slide, as well as I invite you to go to our website, conversationsofalifetime.org. Hope you all enjoy the summit, and thanks so much for the invitation.